Hello everyone, welcome to another episode of Echoes of Realities. I am your host Precious Adeojo. October is the Breast Cancer Awareness Month, and today we'll be talking about the breast cancer awareness. Breast cancer does not only affect the body, it also affects our emotions, families, and the community. But the good news is early detections and prevention can help treat breast cancer. To shed more light on this topic, we'll be having a health practitioner who will be enlightening us on these pressing issues. But before I introduce our guests, we'll go on a short break and I'll be right back. Welcome back. If you're just joining us, this is Echoes of Realities. I am your host, Precious, and today we'll be talking about breast cancer awareness. Like I said earlier, I have an important person sitting right next to me, Mrs. Ojo Oluwabumi Ade Ayodele. Welcome to our show, ma'am.
Good morning, Miss Precious.
Good morning, ma. Ma, please can you tell our listeners about you?
Okay. My name is Ashia, as Riley said. My name is Mrs. Oluwabumi Ayodele. So I'm an health practitioner. I work with Lagos State Health Service Commission as a nurse.
Okay, thank you very much, ma. Thank you for joining us on our show today. So let me start from asking you, since you know we're talking about breast cancer, so I'll just start from asking you, what is breast cancer, like in a term that everyone can understand what breast cancer, because it's not everyone that really understand what breast cancer is. Can you tell us what breast cancer is?
Okay, briefly, breast cancer is just one of the type of cancer. So I'll give the definition of cancer. Okay. Cancer is abnormal growth, so that affects the cells of the body. So, and if not controlled, it can endanger the affected person's life. So the breast cancer is the abnormal cells growth that is localized in the breast.
Okay, some people say that there are always lumps in the breast, that like is the lumps that causes the breast cancer.
The lumps cannot cause, or mass cannot cause breast cancer automatically like that. Okay, so but it's part of the signs that you know if the individual can predispose to the breast cancer or not. We talk about breast self-examination. So if you are conversant with the shapes, the symmetry of your breast, we talk about breast self-examination, which is supposed to be done maybe once in a month, especially after menses, so that the breast will still be bulging and all that. You'll be able to do the examination very well. You stand at the front of the mirror, the arms down, one of the arms to maybe the right arms to examine the left the breast, then the left to the right. So if once there is an abnormal swelling or abnormal mass, then you report to the hospital. So if it is discovered that is a lump, it will be removed, and it will be these cells will be studied before it will be finally diagnosed to be a cancer. So it's not all the norms that lead to cancer.
Okay, thank you very much, ma. So a lot of people will say that breast cancer usually they usually occur in most females, like breast, like doesn't it, like not like because they are busty, but because they have breasts, like females, they have breasts. So they say breast cancer mostly occurs with like female. So is it true? Like doesn't it occur with male genders? Yes.
Breast cancer occurs in female because of the hormonal changes. And in particular, the way our breast, the growth hormones, the way it works on the female breast is different from the way it will be in the main gender. So majorly it occurs in female because of the hormonal changes and the way the breast is being, the reproductive shape of the breast.
Okay, does this also occur in male too?
No.
Okay,
no,
it doesn't. Okay,
so that is based on the influence of the growth hormone, the way nature have already designed it.
Okay, ma. So what are the signs we feel? Like, what are the signs a person will feel so that, okay, it's like I'm having breast cancer, let me go and see my doctor or any practitioner?
There is no one that can diagnose herself that she's having breast cancer all of a sudden. So let me just talk about the signs of cancer generally.
Okay.
We don't really have the major causes of cancer, but we have predisposing factors. That is the factors that can predispose an individual to cancer. So lifestyle is there, maybe smoking, alcohol consumption, poor dieting. Then physical inactive. The way the nature God created us, the cells, they grow, they divide, and they dies. So there is a signals. Okay, when a particular cell wants to grow, now it will grow from cell to tissue, from tissue to organ, which we can be able to see that, okay, this is my eye, this is my head, this is my this. So they started from the little part, which is cell, tissue, organ. So the way it is, nature will give a signal that, okay, stop the growth. But if there is an abnormal cells, it will continue to grow. It will continue to grow like that. So lifestyle of the individual, smoking, alcohol consumption, and all that. So research has shows that there are constituents in those things that can that can affect the cells not to grow properly. Then we have poor diet. When you are not eating well, your immunity, everything in your body will not function well. Then true. exposure to radiation, infection at HPV pylori and HPV, and then hepatitis B infection. So those are the predisposing factor. Hereditary is the major one. If it is familiar, that is, it runs in the family, is the major one of the causes of the cancer generally, and in particular breast cancer too.
Okay, thank you very much.
You're
ma'am.
welcome.
So let's go on a short break. We'll be right back.
All right.
Welcome back, our listeners. Today we'll be talking about breast cancer awareness, and for those that have been with us right from the beginning of the show, this is Mrs. Ojo. Okay, so Mrs. Ojo, I would like to ask, what are the solutions to breast cancer? What preventive measures do someone has to take for breast cancer?
Let me first answer the first question. The first solution is to go to the hospital. Okay, once the individual has been diagnosed, that the individual is having breast cancer. Though the type of the cancer, which we've already said is breast cancer. Sorry, are you the cancer? The stages, we have stages.
Yes.
The extent the cells, those abnormal cells that have spread to the body, they can invariably affect the other organs of the body or tissue. So after the individual have been reported to the hospital, the treatment will be based on the stages of the cancer. So we have surgery. The individual can go for surgery. We have radiation therapy. They will expose the individual to high energy rays to kill those abnormal cells. Then we have chemotherapy. So where the individual will be on medications. It still falls back on the stages of the cancer that will determine how long the medication will be on. The individual will be on the medication. Then the other one, we have a immunotherapy. The immunotherapy is to boost the individual immunity in order to be able to fight against that cancer. So that's that.
So what preventive measures do one has to take in order not to get cancers?
So number one, especially ladies, is common in us. It's common in ladies that they used to wear bra for long. So make sure maybe you are about to sleep, remove the bra for the breast to be able to breathe well, at least for aeration, proper aeration. Then when you are sleeping, you don't lie on your face because of the pressure. Do you understand? Because of the pressure there, we have aloe veras, fats there. Do you understand? Yes, so if you are lying, the pressure can, we are just talking about the factors that can predispose, and based on the experience and the people that we've seen that doesn't run in their family, but they have this kind of habits. So when you want to sleep, don't lie on your back. If you are used to it, you can just tell maybe your siblings. If you are not married, if you are married, tell your partner, please, if you see that I've rolled to lie on my face, just help me, tap me to adjust. So you don't lie on your face. Then at the same time, be conversant with your body part, the breast. Do self-examination, breast self-examination every month, at least every month, to be able to see if there is abnormal growth or something. Then if you notice any abnormal growth, you report. There is a case, a 19-year-old girl, discover a lump. So when she discovered a lump at the right side of the breast, so it was removed. They did biopsy. Do you understand? So study the cell, if it can grow to become cancer. But there is nothing like that. But next, maybe after some months, so they discovered that there is another growth in the left breast, and after the studies, they discovered that it was cancerous. Although the parents are still contemplating whether they remove it or not. But the best thing, everything is under God. Do you understand?
Yeah, yes, ma'am.
Everything is under God. But the best thing medically is to remove it. But if they prayed, if they can go, some people, they will say they have faith. Somebody that don't have faith for the headache to go, and you not be saying you have faith for the cancer to go. Yeah. It depends on your faith. I'm a woman of faith. Do you understand? So if your faith can carry it, and it will be you strongly believe that God can heal you, then you can just forget about it. Adding being, the lady is not conservative with her body. The second one that grows, they've studied the first one. It's not a fabricated story. It happened to someone that I know. Do you understand? So Adding being, the person that have studied, they say, the other one, there is nothing there. Let's ignore it. It should have become something else now. Although I didn't follow up to know what they later decide on.
So you're saying cancer, once it happens, occurs in one side of the breast, it spreads.
Once there is an abnormal growth, saying yes, you report. Okay. Do you understand? You report abnormal growth. You report. Go to the hospital. They will remove the mass. It's like a fat, so to say. They will remove it. They will study it in the lab. Do you understand? If it's just a growth as a result of our normal growth. Do you understand? Normal abnormal growth. Maybe the person used it to eat something and you're now inflamed. So they will study this. So if it cannot lead to cancer, they will let you know, and they will tell you to be coming for follow-up.
Yeah. Thank you very much, ma. So what are your message to those that have cancer now? Because it's not some people now, they not quickly realize how to prevent cancer from occurring in their system, and so they have cancer now. So what are your message? Diagnosed. Yes, what are your message to those that have cancers?
Although it's not an easy experience, it's those that happen to that really knows the pains that it involves. The individual will seriously be in pain, both the psychological pain and the physical pain. Even the family that are involved in the care too, they will be in pain. But that's not the end of life. What they're supposed to do is to just, they should put their mind together, because by thinking, you can even cause more havoc. Because thinking will not solve the problem. It will rather cause another problem to their system. Then they will try and meet a counselor that will be counseling, going for counseling, and they should click to God. There is nothing God cannot do.
So thank you very much for giving us those, for teaching us and enlightening us on this topic. So Ma, can you give us your final take?
In summary, early detection is the best. Breast self-examination is advised for everyone, every female, to examine their breasts once in a month after menses, and those that reach their age of menopause, they should still be examining it at their own convenient time. So examine your breast, and if there is abnormal swelling or mass or growth, you report to the hospital. Then once you have been diagnosed, just follow the procedure, and everything will be fine.
Yes, and see a therapy too, so that you will not think too much. Thank you very much, Ma, for coming to our show.
You're welcome.
Thank you very much.
You're welcome.
So see you next time. Bye.